I live in Blantyre, Malawi, where I conduct both observational research and interventional clinical trials using children with cerebral malaria. Cerebral malaria is just defined as coma in the presence of a malaria infection. And in Africa, most of it is due to a parasite called Plasmodium falciparum. It's the deadliest form of malaria. And cerebral malaria has a very high risk of both death and neurologic disability in the children who survive it. It affects mainly children who are 5 years of age and under, and about 95% of cases are in sub-Saharan Africa. It kills about 50,000 kids a year and leaves a lot of neurologically disabled children. Our mortality rate is one of the lowest on the continent, and we've done a lot of studies to try and improve the care of these kids. One of the things that was very early on noticed in cerebral malaria was blood sugar or blood glucose. And it was found that if the glucose was too low, the child was at very, very high risk of death. Here we use a different kind of measurement system than you do in the United States, but a blood glucose of less than 2.2 really increases your risk of both death and neurologic disability. But the World Health Organization, who writes the guidelines, they write something called, I think, malaria treatment guidelines every few years, didn't do a wonderful job of telling people working on the continent and caring for children with cerebral malaria the optimal timing of checking of blood glucose and the optimal duration of time that you should check it. You should check it every 6 hours, at least every 6 hours for the first 24 hours. And if it's normal during that first 24 hours, you can stop. But if it's not normal, anytime within the first 24 hours, you need to collect for an additional 24 hours. So that will capture 100% of the children who have a glucose level of 2.2 or less. But it's just enough, but it's not too much, right? We're in a resource limited area, right? It's not like America where basically people will do 100 million lab tests all the time. We have to be very judicious about what we do because each time we do one of these lab tests, it costs money. And we have to always be very smart and do just enough, but not too much. I'm hoping that if we can help clinicians on the continent better care for children with severe malaria, which includes cerebral malaria, that it will decrease the death rate and improve neurologic outcomes in those that do survive. We know that if children have low blood sugar and it's not treated, it increases their risk of death and it increases their risk of having neurologic abnormalities if they do survive. And so obviously, I mean, it's my hope